Hey, if you haven't noticed, the world is changing, and so is healthcare. So is the landscape of the healthcare system and how we actually view health, right? And this is the new state of what we call functional medicine. You know, if COVID has shown us anything, is that our current healthcare model is really failing us. Right, the complications with COVID, right, well, what they call the comorbidity factors with COVID, right, stand around high blood pressure, obesity, diabetes, cardiovascular disease, right? People who have those underlying issues are much more vulnerable to more serious complications if they get COVID, right? We all know that, but that's like half of the population of people. Right? The current state of our healthcare system, has half the population's obese, diabetic, high blood pressure, cardiovascular disease. Right? The number one drug, I believe, is statin drugs, right, to treat so-called cardiovascular disease. Yet it's a failing model. People are finally beginning to wake up. Right? Now the healthcare system is changing. I'm not just saying in the matter of that now we're moving into a virtual world, which is pretty cool, right? But people have much more ease of access to their doctors and health coaches through virtual technology and stuff, and that's a wonderful shift, right? But people are really starting to wake up and beginning to understand that there's got to be a better way, right? People are just tired of being told to take a drug for every symptom they have and have to deal with all of the side effects of those medications. People are just getting tired of it. And so they're looking for better answers, right? And so functional medicine has been around for about 25 years, but it is really gaining traction now, and for good reason, right? The reason is that because what's really plaguing people, especially baby boomers, but is chronic degenerative diseases. From cardiovascular diseases to mental health diseases to things like fibromyalgia, autoimmune diseases. And the reality is, in the conventional medical model, there's no answers. There's no answers. All they can do is just give us more drugs to pacify the symptoms, which is just pushing it deeper and suppressing it, right? And the body just cries out for better responses. I always kind of say, if you have high blood pressure and your doctor has you on blood pressure medication, it will lower your blood pressure, and we may need that, certainly. But if you ask your doctor, when can I get off the blood pressure medication, the answer is often never. Why? Because if you stop taking the medication, your blood pressure goes right back up, right? So all the medication is doing is suppressing it. It's not addressing the causes. Why do you have high blood pressure? And functional medicine is really based in the idea, the premise of looking at the root causes, right? So we start getting into lifestyle factors, everything from how we move, how we sleep, how we eat, right? Maybe supporting it with nutritional supplementations when there's deficiencies, right? And the really cool thing about it is that when you're working with someone who is a functional practitioner, who's a really good skilled practitioner, right? You're actually partnering with them, right? Just like professional athletes have coaches to be able to see when their things aren't really kind of working right, how they can steer them back on track to get the best out of their expertise or their capabilities, right? Is that functional medicine works with you to discover where the roadblocks are and how to help you remove those roadblocks to help transform your life. Right? And that's kind of a pretty cool thing, right? So functional tests, if you've heard of them, there are many, but they can look at where there are hormone imbalances and gut disturbances, stress factors, food-related sensitivities. At the end of the day, what we're really trying to do, right, is we want to, what it is, there's a term called tolerance. And tolerance is referring to our immune systems. Right? And if you really think about it, right, what we're seeing in all aspects of chronic health challenges, okay, whether they're mental health, cardiovascular health, autoimmune conditions, fatigue problems, hormone imbalances, right? What's really happening, the common denominator, is that the immune system, our defense system, is becoming quite imbalanced. It's not regulating properly. And so our immune system is becoming less tolerant of the world that we live in. The purpose of your immune system is your defense system, right? But we want to become tolerant of the world that we live in. We should become more tolerant of the foods we eat, tolerant of the bacteria and viruses that we're exposed to on a daily basis, tolerant of the chemicals that we get exposed to, right? And what we're seeing today is people that are just not tolerant. Every chemical they're exposed to, they get massive headaches, they want fatiguing, they get anxiety. People don't know what foods to eat anymore. Every food seems to create a problem for them, and they're eating more and more restricted diets, right? And yeah, they're running tests to say which foods they should and shouldn't eat, but that's not really solving the problem. So if you run a test that says don't eat this and you don't eat that, is that going to magically transform your life? The answer typically is not. You're just avoiding something. You're not really making a transformational change, which is to help your immune system become more tolerant of the world that you live in. So truly, in working with a functional practitioner, is to help you and your immune system basically become much more tolerant of the world that you're in, right? So that you can live and enjoy the life, right? And feel more confident that you are in the driver's seat, reducing your risk of diabetes, reducing the risk of cardiovascular diseases, reducing your risk of memory loss and cognitive changes, right? These are really what it's all about. So I hope this has been a little bit insightful, but there is truly a big shift taking place, right? And if you're new to functional medicine, I'd encourage you also just go to our website, the getwell-now.com. It's filled with a lot of free information, free resources of information, all about functional medicine and testing, so you can get yourself a little bit more familiar with that. Thanks for listening.